Welcome to another episode of Vital Doctalk. And on today's show, we have Dr. Amy Dayries. Dr. Amy, welcome to the show.
Thank you so much for having me, Vlad. I really am excited to be on here today.
I'm excited to have you on the episode. So in traditional standard fashion, why don't you tell us about your background, how you got started in the medical field, what inspired you, and where you're looking to go?
Sure. I'm one of those people that felt like I had a purpose, and I knew by the age of 4 that I wanted to be a dentist. I went to my first dental appointment at age 4. I remember that. And I came home and I told my mom I was going to be a dentist when I grew up. I've always had an affinity for arts and crafts. As a young girl, I like to work with my hands. I don't really like sitting at a desk so much. I love working with people. And then I knew about these things when I was a kid. I did a lot of arts and crafts, painting and things. And then my grandmother got very sick when I was in my senior year in high school and lived with us. And we would go back and forth to hospital and doctor's visits. And I realized I didn't want to be in a hospital. So again and again, dentistry was sort of affirmed as something I'd like to do. I was a dental patient many times over. I had a lot of orthodontics. And that's really what started. There were different things that kind of started my background. And then later I went to Emory University for undergraduate, and then the Medical College of Georgia in Augusta for dental school. And I've been practicing since '96, and I came back to my hometown outside of Atlanta, Georgia. And over the years, I've fed back into it a lot of things from my childhood: gardening tips, to herbal medicine tips, to really, I did an integrative medicine fellowship. Graduated from AIHM, Academy of Integrative Health and Medicine, several years ago. I was the first dentist.
That's awesome, by the way. And did not know that Dr. Amy here, who just definitely does not look it, has been in the field for over 20 years now. A lot of experience on the show. So Dr. Amy, well, the future, actually, we almost glossed over that. Where do you see yourself going in the future? You're going to write a book, more, teaching, coaching, what is it?
Great question. I love having patient care, but I see a lot of a need in my profession to really turn our profession over to the 21st, 22nd century. I did actually write a book. It's called Solve Your Sleep, Get to the Core of Your Snore for Better Health. And it's available on Amazon as of yesterday, August 18th, 2020. And,
wow, I love it.
Thank you. I'm really excited. So I have been teaching some medical and dental colleagues. I get to do some pretty big conferences in the next year. I'm going to be a keynote speaker at the California Dental Association conference, and he's speaking here in the Southeast at the Henman in 2021. I want to teach my colleagues about all the ways that integrative medicine, appreciating a holistic approach to dental and medical care, is really the new wave of what people want in terms of healthcare, and what can we learn from evidence-based medicine, and how do we support our patient in choosing how they want to be treated, not just how we were taught in school to be treated. So I'd love to open up those channels and have a lot more offerings that we know are tried and true and can work, and open up the dentist's mind to the whole field of integrative medicine.
Yeah, I think what makes Dr. Amy really unique, guys, is that she actually sees dentistry and more of like a holistic sense, which I think is very rare. And that makes her very unique. And why did you focus the book on sleep, by the way?
Oh, great question. So I make a lot of sleep appliances. A lot of times when people later in life get crooked teeth, or they developed crooked teeth as a child, it's because they didn't have support of the tongue. They have a tongue thrust a lot of times, or they might have an unhealed concussion injury. And we are starting to connect the dots medically and dentally and seeing how all the pieces fit together. When we found crooked teeth, a lot of times we find these tongue habits, which also can tell us that there may be an overstimulation of the vagus nerve. You might have heard of the polyvagal theory. And it creates more anxiety in patients when this is overstimulated. There may be a tongue tie, but you'll get crooked teeth because the tongue isn't supporting the roof of the mouth like it was intended to do. So we're getting back to the roots. Back apparently when we were birthed by midwives, the midwife would check for a tongue tie in a newborn. And this is where we're getting back to doing with patients born at the hospital. But for many decades, we haven't looked at these things. We dismiss that stuff as not important. The world of orthodontics on the whole does not appreciate the windpipe. It's making teeth look better. But there's really nowadays a combination of treating sleep apnea, whereas the gold standard of sleep apnea treatment used to be the CPAP. Now we're realizing oral appliances can actually grow the face. So I have a little skull here. It can grow this yellow bone, the maxilla, which is not only the front of the face where the cheekbones are, but it's also most of the roof of the mouth. And these new appliances can actually grow, and like your face is a pop-out camper, it can grow the side of the face out, and then the windpipe is actually brought alongside it, and we actually get a larger girth or volume of windpipe. And so it can help really address a lot of sleep apnea issues. It's really exciting. So that's why I wrote a book on sleep, to connect all those dots.
That's awesome. I think sleep is super important, right? And especially in the world of business, and that's where I come from, and a lot of people hype it up as you got to work through the night and burning the midnight oil and all that, and I think that's way overhyped. So I think it's important to get the right rest. So tell us more about how you've grown your practice. Now, somebody that's been in business for 20 years, right? I could easily presume that word of mouth has been huge for you, and that's probably been just fun. At this point, your Rolodex is probably count like infinite. But tell us what have been the major breakthroughs in terms of growing your practice that you made early on versus today, and what advice you'd give yourself.
All right. Well, I'm a mom, and so a lot of ties in my community are through my kids, and that is a fundamental way that I've made ties in my community. I'm also practicing, as I mentioned, in my hometown. So I got involved in community things where people got to know me and find that I could hopefully be a trustworthy spokesperson and advocate for them. I did Girl Scouts. I was a Girl Scout leader. I was actually a Sunday school teacher as well for a while. But then as I went through and learned more techniques and started feeding those back into my practice, I reached out to some of my colleagues, integrative medicine colleagues, holistic medicine colleagues, and tried to find a team of people, because a lot of what I do, I need the support of my colleagues to really fully treat a patient and get them as far down the health road as possible. So that's been a major way to improve business. It's been huge. And then people too, when they come to you either via community or through a referral of a colleague, there's already a trust there. They believe in you already. There's a lot less background stuff you have to do to kind of fill in those blanks and establish your credibility for them.
I love that. And I think what you've done probably over the years, I don't know if it's conscious or unconscious, but you've noticed hey, I'm a Girl Scout teacher, or or leading the, not a teacher, this is my affiliation with the Girl Scouts, but basically hey, I'm leading the Girl Scouts here, and that's a community, and I can tap into that. How has that translated into business? Do you teach all the Girl Scouts to go door to door and tell people to visit your practice? What's the what are the insights there?
Good question. I think knowing that you want to be standing behind a product you believe in. So if you want to relate it back to Girl Scouts, we always had to sell cookies, right? So knowing your product, knowing what it can do, what it can offer, knowing the science, in my case, behind what something's going to be able to do, what are the limitations, but what are also the opportunities, and taking that information and being able to communicate it back to the person. So, sometimes people learn through visual arts. So maybe we send them home with handouts that they might find on their desk later. I'm at my desk, which is covered in papers, but I know where everything is. But you might find this piece of paper wandering around 6 months after your dental appointment where we wrote about how you have some sleep issues, or maybe how you might want to try certain vitamins because that can support sleep. For instance, if you're low on magnesium, as we found that 85% of Americans are, you're much more likely to grind your teeth. Well, that could cause breakdown of filling work, where you now need dental work, or you may start looking like you have a sleep issue. In fact, you may have a sleep issue because you're low in magnesium. So visual arts, talking about things, having your staff trained, having your cookie sales force trained. These things, they do tie back in. It doesn't matter what your industry is, but it works across all boards. Be truthful, humble, believe in your product, be honest, and be willing to keep going back to the drawing board if something isn't right, or maybe you could communicate something better. Be open to learning.
I love that. And, with periods like COVID, obviously negatively impacting a lot of the industry, I'm sure there's been times in your career where, you haven't gotten as much business as you wanted to, right? So what have you done during those times when, you had to go back to the drawing board? And what are kind of been some of those breakthroughs? Because I think, everybody likes to imagine the grass is greener, the person's up and to the right, straight arrow to the top, right? But I obviously I've learned personally is it's cyclical, right? And there's always ups and downs. So what have you learned to get patients during those rougher times?
Getting patients through those rougher times. Going back to, do you have good systems in place in your business? How are you recruiting and looking at, like, we have some really pretty good dental software parameters in terms of looking at how your business has grown in the past. Did you have certain good referral sources in the past, and maybe going back and reaching out to those places, or giving them a basket that features some flyers on what you're currently doing? What are the new things that are going on in your business that maybe they didn't know? Like you asked me about sleep. What does sleep have to do with teeth? Well, quite a lot. But, maybe getting people familiar with the services you offer. That's reaching out again into your community. We all need each other. And marketing your services, what you offer, that's the best way. And in fact, we've been very blessed. We've actually grown this year, even though we were shut down for almost 2 months, and our numbers are up, which is it's a total blessing. But it's through hard work, and I'm always looking at what the next step is. And so just again, you can't get lazy. You got to stay on top of things. Because the market's always changing. What people want changes, and trying to cater to those, creating that awareness about what you can offer, and marketing.
That's great. I think that, you keep tying it back to the community, and I keep trying to say, what about not the community, whatever, but then you're like, well, you go back to the community, and then the community will help. And I think a lot of us, even during, COVID, et cetera, going back to the community, you can get all the help you need. Right? Whether it's doing, reaching out to your largest referral partners, hopefully, you guys out there are tracking that. Or if it's, leading the local Girl Scout troop or whatever you want to do, right? Church, local farmers market, et cetera, right? Whatever's active. And if you just partake in that and then find a way to tie it into what you do, I think that can be great promotion. That sounds like that's how you've grown. Do you ask your patients for referrals, since word of mouth is, so key, or do you find it happens organically? What's that process look like?
Really good question. Many years ago, I would try to single out maybe one person a day to ask about referrals. But really, people know about us now, and we do email lists. We've done mailers. We've tried a lot of things over time, but really what's been the best for me is connecting with colleagues in the medical and other healthcare industries, and letting them know what we do. I think, education is so key. And again, having good systems, figuring out what is your passion in your own business, and delineating yourself from the competition. And I would say probably every single industry or business or form of healthcare is going to have something that you might find more interesting than the next person. And in a way, in the system of healthcare, we're almost all like roommates. Maybe I like to mop the floor and you like to scrub the sink, but find what it is that really makes you tick, because that's going to show and come across with your patients. And I think leave an indelible memory that, hey, they do that over there. So that's, again, I keep going back to the community, but it is about positioning yourself. It is about getting the education. There's a lot of availability in terms of CE courses, continuing education courses online now. There's such a desire, I think, for people seeking out. A lot of people don't want to take pharmaceuticals when they get older. So how can, in your industry, look at the trends that are happening in medicine, people wanting to be more self-empowered? How do we assist them getting what they want? And in my industry of dentistry, about 90% of dental practices are still small businesses here in the United States. So we're not generally franchises. What are trends in healthcare? Well, the teeth are between the brain and the heart. The tongue is the second muscle to develop after the heart, which is why it's connected with the vagus nerve. Looking at trends, people are stressed out. They're not sleeping well. They might have dental problems. They may have inconsistent health care because their insurance changed. They used to have Obamacare. They don't have Obamacare now. How do we connect what they need and let them know that we're here?
That's great. It seems like you've done a phenomenal job over the years of looking at the trends and how what you're focusing on relates to the current, news and whatever the media is in the present day. And that's where you find your message. And then after you have your message, then you can tie it back to your communities and social media, et cetera. So I really appreciate that. If a doctor was listening to this interview, what would be kind of their takeaway? What would you tell them to do to focus on improving their practice if you could sum it up for them?
If they're looking at growing their practice, make a list. Start with a list of what's worked for marketing or growth in the past, what hasn't worked so well. If you're not sure, go back and look at software or how are you measuring that data, or maybe you start measuring data that if you haven't before. Do you have the right people behind you in place? People of integrity, people who are willing to be hard workers, and identify where you've got gaps, and be forgiving and treat anyone that you work with compassion, where hopefully you're breaking down the defensive nature that people have that can be buried in an old thing that has nothing to do with you, about something where they felt shamed in the past. Breaking down those defensive barriers and pulling people together to be solution-based. And that's what we've been really trying to do. And then get the training to fill in those gaps where you've got so that you cover those places where you realize you've got weaknesses. But start with lists. Just jot down lists. It doesn't have to take long. It doesn't have to be high tech.
I like that, and that's very simple too, right? Like if you just start with a list and you start out focusing on where the issue is, then you can, just consistently create those steps, those, tiny steps, and then that's how you're going to progress. So I really appreciate that. And you made it through the podcast interview. So thank you so much, Dr. Amy. So, show us your book one more time. Tell us where we can find you. Plug it up.
You can find the link on Amazon. It's called Solve Your Sleep. Mm-hmm. Get to the Core of Your Snore for Better Health by Dr. Amy Dayries. It's on Amazon. Hopefully you might hear me at a medical or dental conference sometime soon. It's 11 chapters. There's one chapter devoted to oral sleep appliances. But a lot of the other chapters have to do with how do we measure sleep, what do sleep tests show, what herbal medicines can help with sleep, what lifestyle changes can help with sleep, what vitamins directly influence sleep, what gene SNPs, single nucleotide polymorphisms, are connected to poor or bad sleep, and how do we amp those up or take those down if they're too amped up, and concussion therapy, how does that relate to sleep? So that's in a nutshell what the book's about, and hopefully that will reach some people out there.
For sure. And thank you guys so much. That was another episode of Vital Doc Talk.